Episode here, Jaws Podiatry. We're here in our office-based surgical suite. We just finished performing a CHEILECTOMY procedure using our minimally invasive techniques. Hallux limitus, a condition that we've spoken about in the past before. Excuse me. Pull this down a little bit. Hallux limitus, a condition that we've spoken about before in the past. It's a type of arthritis of the great toe joint. It can be quite painful or actually very painful. So what we did today was we basically just, the CHEILECTOMY, also known as the remodeling and shaving of the entire joint, so to speak, to provide the patient some more range of motion. There's an accumulation of bone that develops on the top of the joint. So what we basically did was we shaved that down. It's a very conservative but yet effective procedure. And you know, when we put the puzzle together in respect to age, level of activity, just to name a few, those are the variables that dictate whether or not we pursue something as such. So I just wanted to give everyone, a little sneak peek here. When we talk about one stitch, come around please. Let's get closer there. So that's where we perform. This is just one stitch. That's the incision. We'll put one little stitch. But now, before the procedure, the patient was not able to do this. There was the joint was actually extremely stiff. Number one. Number two, it was jamming. And the patient was having a hard time wearing, even not really high heels, but even just small pumps. And what we basically did was, this is all anesthesia, if anyone is wondering, all this puffiness around here. But, what we did was we remodeled all of the entire joint, a little bit here, a little bit here, a little bit here, to provide that, the patient that range of motion. So not only is there going to be pain relief, but, she'll be definitely be able to use, these pumps that she's been obviously wanting to wear pain-free. So, again, we're here in our office-based surgical suite. The patient is wide awake. This has been performed under local anesthesia, about half an hour or so. But it's, like I said before, it's an extremely effective procedure. So we're going to go ahead and put one little stitch there, and that's pretty much it. I can already feel, right? I can already feel that there is no bone. We have already remodeled everything, and maybe you guys can tell or maybe not, but there's a little dell here, and that is that's where the bone used to be. Now it's obviously gone. It's been pulverized. So I know that everyone in the world of our YouTube channel has been asking me over and over, please show the procedures. That really boils down to the patient, and some patients just like their privacy nonetheless. So I will continue to try to upload more and more videos, educating the world on minimally invasive foot and ankle surgery, and most importantly, that minimally invasive foot and ankle surgery does exist. As always, www.jawspodiatry.com, Instagram, Dr. Toe Jam, Jaws Podiatry, Facebook, and last but not least, our YouTube.